My name is Andrea Darden. I am married. I have 3 children. I am a social worker by profession. I work in the mental health field with children, adolescents, and families as a program director. I never noticed that anything was wrong. I was actually going for my annual mammogram, and it was only the second one that I ever had. And from that visit and that exam, they discovered something abnormal that they wanted to follow up with. And that is what led to the diagnosis of triple-negative breast cancer.
Andrea Darden had a very specific type of breast cancer called triple-negative. It's also associated with the mutation or the inherited gene that puts people at risk for getting both breast and ovarian cancer. And in her case, she ended up having the gene mutation for developing breast and ovarian cancer, even though nobody in her family actually had breast or ovarian cancer. The cancer itself was found at a relatively early stage, meaning that it had not spread to lymph nodes, which is usually a good sign. In her case, since it was a triple-negative breast cancer, she ended up receiving chemotherapy to reduce the risk of developing spread of the cancer in the future.
It was very difficult. I was in the middle of a lot of things in my life. I was in the middle of a doctoral program at the time, and I have a daughter who is autistic as well, and I have a son who's in high school and another one who's in college, and I was working full-time also. I kept my spirits up through leaning on my faith, praying a lot, and the support of my family, and them letting me know that they had me. Definitely my husband, he was my caretaker.
Andrea's treatment plan was put together by a number of specialists at our multidisciplinary breast conference. She was recommended to have not only treatment of the breast with cancer in it, but also treatment of the other breast because of a risk of cancer in the future. So she elected to have both removed.
I am doing well now. I am free of cancer, and the next steps for me are to let others know about my experience. This is really the first time that I'm really sharing my story with others outside of my family. I had always been involved in breast cancer awareness. I had participated in a lot of the walks. I never imagined that I would be on the other side of it. I want other women to know the importance of getting their mammograms. I want them to know not to delay it or push it off.
It's very easy when you're facing this type of a diagnosis to pull back into a shell and go into a protective mode. That was not Andrea Darden. She completed her PhD and became a doctor while all of this was going on. Not only is she brave in terms of what she faced and how she handled it, but she pushed forward with her life, and I give her a lot of credit for that. The survival from breast cancer has improved more in the past several years than it ever has before, and this is related to increased awareness, early detection, and improved treatments. So those 3 things have really come together to make an impact on breast cancer survival better than any that we've ever seen in the past.
If I could describe to someone my care at Prisma Health, I would recommend Dr. Kim and his team. They were very warm and very kind and very understanding, and let me know that I was going to be okay.